Hello, everyone. I'm Dr. Orisha Bowers with the Harm Reduction Coalition, and we're here today to talk about the HEP Connect initiative. So National Harm Reduction Coalition creates spaces for dialogue and action that help heal the harms caused by racialized drug policies. We do our work through 5 domains, which are policy and advocacy, regional, national, regional meetings, training, technical assistance, overdose prevention, and providing resources and publications to the harm reduction movement across the United States. Principles of harm reduction. Principles of harm reduction are a framework that provides or lifts up health and dignity of individuals, participant-centered services, participant involvement from the beginning through the execution of initiatives, participant autonomy, meaning folks are able to opt in and decide the best ways in which they can engage with work, socio-cultural factors, and pragmatism and realism. Integrate the principles of harm reduction throughout all of the work that we do. So HEP Connect. What exactly is HEP Connect? HEP Connect is an initiative whose goal was to eradicate hepatitis C and expand access to national harm reduction services across 5 southern states. Those states are Indiana, Kentucky, North Carolina, Tennessee, and West Virginia. Now, there are some key factors that were considered when deciding which states we would launch these initiatives in. We saw a rise in injecting opioids across the country, but specifically in the Appalachian states, where we saw a surge in the number of hepatitis C infections. Some of the highest rates of Hep C infections were found in these 5 states, and also a high rate of opioid and injection drug use in those areas as well. Next slide. When we were awarded the HEP Connect, when we were awarded the HEP Connect award, we launched on a national level as well as in the 5 states. We held individual launches, and the photos that you see here are when we launched in the 5 states. So what was the purpose of those state launches? One was to ensure that individuals in the community were aware of the HEP Connect initiative, as well as to create a space for community members to come and talk to us about hepatitis C, as well as injection drug use, and provide feedback and input into the process that we would use to roll out the initiative. We also held consultation calls with members of the community with lived experience to be able to ensure that we have the voices of those individuals who are most impacted included in our initial information gathering. Next slide. And so here you see some photos from some of the state launches, which were held in April through June of 2019. Next slide. On these slides, you'll see some demographic information, just letting you know what those consultation calls and state launches consisted of. And we asked questions like, what was the funding? What was most important for folks to get funding for? What barriers were people facing in terms of program implementation? What were some of the dynamics between larger organizations and grassroots organizations, as well as for folks who use drugs? What would make the greatest impact on their ability to access harm reduction services? And other things like that were asked so that we were able, again, to hear from folks directly what they believe that they needed to be thriving in their communities. Once we received that information, we began crafting the request for proposals, and we used the feedback and information from those sessions to create a process for requesting funds that was simple, that considered folks who did not have access to a lot of high level technology. So we basically wanted to keep the process very simple for community members so that we were able to level the playing field for folks who don't always receive these opportunities in the community. Next slide. Some of the things that came out of the consultation with people who use drugs was that they wanted to use funds to establish paid positions at a leadership level for organizations rather than incentives like gift cards and things that were more temporary. They wanted long-term opportunities that would be long-term and create sustainability for folks in the community to be able to, again, establish their lives as well as do this life-saving work that they were able to do. The selection committee was made up of folks, stakeholders from all the different states, folks on the national level as well as regional level, and these were folks who had content expertise in the areas of harm reduction and hepatitis C. We also wanted to make sure that we had members on those teams who had deep roots and experience in the region and had experience with grant making. It was very important for us to have a variety of perspectives in the conversation to ensure that we were upholding the values that were important for us to stay in line with the feedback that we received from community members, but also to carry out, find the right partners to carry out the work that folks were planning on doing. Next slide. So there was a ranking matrix where we looked at the needs that the applicants were expressing that they had, values, and were their values aligned with the values of the grant making selection committee, what was the impact that they were trying to make, and if they had a clear-cut strategy for how they would be able to carry out their work. Were they a good fit for this opportunity? Some of the additional considerations that we had was if they had were going to be able to provide qualitative data that might not necessarily be directly reflected in the criteria. So we wanted to take a really close look at their applications to ensure that we were, creating fairness across the line for folks who may not have been as advanced in terms of data collection, how they were expressing their data. We wanted to make sure we were giving people a fair shot at obtaining the funds. Next slide. So the selection committee met in Louisville, Kentucky, and over a number of days we met, we had conversations, we ran our review process separately and together. So there were two categories that the selection committee was looking at to provide and educate applications, and at the end we wrapped up this process and made decisions. Our debriefing session to ensure that, one, we had parity and representation across all 5 states to ensure that the grantees that were selected were going to be covering a large areas within those 5 states, and making sure that there was adequate service provision across all 5 states. And so once those decisions were made, we announced to the world our grantees. So we allocated over $5 million to 44 grantees across the 5 states. And those grantees were all different sizes. There were folks who had lived experience, folks who were focused on education, folks who were focused on syringe exchange, just a variety of different types of creative services that will be provided in those communities. We're very proud of our HEP Connect grantees. So we talked a little bit about the inclusion of, we talked a little bit about the RFP process, but want to specifically highlight the inclusion of people who use drugs. As I mentioned previously, we held phone consultations with individuals who were included from national drug user unions, as well as folks on the ground who had grassroots organizing, grassroots movement building going on in all 5 states. And their feedback and input was extremely, extremely important in terms of helping us to create processes that would be most valuable to people who were most impacted by the programs that we chose to fund. Next, we will transition to Tamika Jackson, who will introduce themselves and talk to you a little bit about where we are today with our grantees.
Hi, everyone. So glad that you're here in this session with us. I'm Tamika Jackson. I am the Harm Reduction Research Manager with the HEP Connect initiative, and I'm actually in Georgia. So after doing the work with the grantees, getting our grantees, awarding funds to the grantees, we started to think about what we wanted to make sure grantees received from us in the forms of technical assistance. So we actually developed a technical assistance assessment where we asked questions of our grantees specifically around their needs we came up with to help them beyond the scope of the HEP Connect initiative. Because some of our grantees were so grassroots, we had organizations that didn't necessarily have a 501c3. We had organizations that needed assistance with their policies and procedures, standard operating procedures, and thinking about how they collect their data for the HEP Connect initiative. So in that assessment, we spent time with each of our grantees. We asked them questions, we checked in to see how they were doing, and we came up with a way to streamline the way that we deliver TA requests once we receive the assessment information from each of those grantees. Our grantees receive information or are connected to a assigned staff person by our fearless leader, Dr. Bowers. Dr. Bowers has come in and assigned each of myself as well as our consultants and our other capacity building manager grantees that we connect with on a one-on-one basis. So we have developed a actual plan to deliver those needs to our grantees individually. And once those plans are developed, we deliver those plans to our grantees so that they can have a starting point, starting from the beginning of creating those policies that I just mentioned, and also helping with policy and advocacy work. If it's needs for funding beyond the HEP Connect initiative, if it's the need for understanding their own data, if it's conversations around getting consultants for their own grant writing work. So that's where the technical assistance kind of begins, but we are actually on the ground with our grantees having conversations about the things that they need in order for their service provision to actually continue. And so we do that on a regular basis. We meet with our grantees all the time and when they need needs met. So after having the assessment calls with our grantees individually, like I mentioned, we customize a technical assistance plan for them, deliver that TA plan, and then we've also created and developed a training calendar to assist with professional development. In that training calendar, or our HEP Connect Training Institute, we have professional development trainings as well as harm reduction specific trainings, which is kind of sort of like a harm reduction 101 track. We also have intersecting training information as well as domestic violence and sexual assault. We have information on funding and grant making opportunities. We have information that is specific to our grantees in the states that they live in. So the information from our technical assistance assessment to help our grantees is to help them to become sustainable and for them to be able to have the things that they need in place in order to provide the services that they are providing. in having those conversations, one of the things that we pulled out is our law enforcement engagement piece. And so I'm going to pass it over to our law enforcement engagement consultant, Tiffany Sevier. Tiffany?
Thank you, Tamika. Good morning, all. Of course, my name is Tiffany Sevier, and I am a consultant with HEP Connect concerning law enforcement organizational development, but I'm concentrating more so on the law enforcement perspective. After a heated discussion, all grantee discussion in June 2020, we decided that we needed to intervene, myself, Dr. Bowers, our team, in discussing law enforcement engagement. Additionally, law enforcement in surrounding southern states who had related experiences engaging with harm reduction programs, and participants were offered the opportunity to participate. I also spoke with interested HRC staff who had done training or had engagements with law enforcement in North Carolina and California to hear about their experiences to determine what types of work have been completed and what resources were available, if any, to grantees. Next slide, please. Our next thing was we created a process. We used 2 specific interview guides that were developed for grantees and law enforcement to ask the similar questions of our participants. As Tamika stated earlier, we did a TA assessment. We did interviews where grantees were asked about their law enforcement engagements. They were also offered the opportunity to participate in the interviews and added to Asana law enforcement areas. Next slide, please. In conducting our TA assessments, we got some standout responses from our grantees, law enforcement officials, basically all parties involved. And some of the things that were stated was, it's a huge need. Most of the engagement we try to keep to a minimum. If people see our participations or our participants, it's a bad thing. We have to share our security plan with them every year. Minimum direct interaction. Our participants need letters of support from us when stopped, because if you are a participant in a North Carolina SSP, you are exempt from charges pertaining to paraphernalia. We usually write letters for our folks. Our law enforcement isn't engaged with anything. We have a new police chief. We need education for police in the area. I met with the chief of police often, or I meet with the chief of police often. I usually can make a phone call if they are messing with our folks. Next slide, please. Some law enforcement preliminary findings include, based on conversations we've had, to date, there are significant opportunities and interest in law enforcement engagement by HEP Connect grantees. HEP Connect grantees want a person they can trust to send on their behalf to have conversations with the police or join them in having conversations with law enforcement officials. Next slide, please. Some law enforcement quotes that we got out of our interviews with them. Police departments are practicing harm reduction. It's just called by a different name. You will not send a person out driving without a seatbelt. You should not send an injection drug user out without Narcan. Both helps to keep the person safe from harm. Officers often would love to be able to assist people, but the rules that govern our work prevents us from doing so. We need training. Enabling officers through policies and procedures in training may allow room for harm reduction to be more successful. Next slide, please. Now I'll turn it back to Dr. Bowers.
Thank you all so much for attending this workshop. I want to offer an opportunity for our panelists to share one closing thought with folks who have spent time with us today. And so my question or my prompt to you is, what has the HEP Connect initiative meant to you? And this is just your own personal feelings, thoughts, but what has it meant to you to be a part of the HEP Connect initiative? And either of you can respond, and I'll respond last.
I'll go first if you guys don't mind. What has it meant to me? Um, Harm reduction is meant to me that we're providing ways for people to come back. We're assisting in ways for people or individuals to be reintegrated into society. We are also providing means for non-judgmental situations, and we're welcoming people, individuals, grantees, law enforcement, engagement, staff, all parties involved. We're welcoming them with open arms.
So the work that we are currently doing is extremely important to me personally, because one of my personal values, of course, is people. Harm reduction surrounds itself in the idea that, yes, we help folks, right? And we don't leave them where we're helping them. We help to bring them forward in the best way possible, just like in the way that we hold folks. We hold folks where they are, we hold them and we help. And we have to be mindful of how our helping can actually hurt. So in harm reduction, we're always thinking of ways to make sure that the way that we are helping is not hurting the folks that we say, that we are helping. It's also important to note that the HEP Connect initiative is Southern facing work. Nationally, what folks want to, it seems like folks want to make sure that folks are lumped in to thinking that everything is the same for all folks, and it's not. The South is different. We are different, and we are extremely excited about being different, and our differences need to be honored in the way that we do things, in the way that we do social service provision. So the HEP Connect initiative is a Southern facing initiative that's working in a region that is sometimes forgotten about nationally. And that's extremely important to note.
What does it mean to be a part of the HEP Connect initiative? So I have the privilege and the responsibility of leading the HEP Connect initiative. As both ladies have stated, it's very different here in the South doing harm reduction work. Sometimes we have some challenges and barriers that are, I feel, a little bit different than what folks may see in other places. While at the same time, we have some challenges and barriers that are very similar to what folks are facing all around the country. I think that for me, it's so super important for us to support the work of folks in the South who have been and are doing harm reduction in the ways that meet the needs of the people in the communities where they live and work. I think it's so important for us to continue to provide these resources and really show up and come alongside these organizations to help them do powerful and impactful work that will be changing lives for years and years to come. And last but most certainly not least, it's so important for me as a Black woman in the South to turn an eye towards the needs of folks of color, for Black folks, people like me that are facing these different challenges, and to be able to build up resources for people who look like me to be able to get the resources that they need to make the choices that they need to make for their lives. For me, that is work that, I'm very grateful to be able to do. This ministry that I'm very grateful to be able to do. And I appreciate the trust of my team and the trust of our grantees to lead this initiative. And so with that being said, we thank you for attending this session and have a wonderful, wonderful, wonderful day.